Excellencies, distinguished guests, friends from the media, ladies and gentlemen. Good afternoon and good day to everyone. My name is Juki and I'm the Executive Director of CARI. We're most delighted to welcome you to today's webinar, How Can ASEAN Bounce Back? Fostering Public Health Safety and Economic Resilience for a Borderless Community, whether or not it is in Malaysia, in ASEAN, or everywhere else. Now, we are most honored to have Datuk Dr. Noor Hisham Abdullah, Director General of Health Malaysia. He is no stranger to us all Malaysians. He is a household name in Malaysia as he updates Malaysia and us on a daily basis on the COVID-19 cases since March this year. And we are truly grateful to him and all the frontliners. We would like to thank all of you who have sent in your questions. We hope that we'll have time for Datuk Noor Hisham to address them later on. But if you didn't send us any question and you would like to do that, you can always type into the Q&A section as well. Before we start, I would like to take this opportunity to inform you that we actually have another CARI briefings on August the 18th from 3 to 4 p.m. in partnership with the US ASEAN Business Council, discussing on-ground insights from the US business perspectives with regards to the COVID-19 pandemic. So please remember to block your calendar and reserve your spot. And without further ado, may I now invite Tan Sri Dr. Munir Majid, our chairman, to take over the session. Tan Sri?
Yes, thank you, Joki. And I'd like to add my words of welcome to everyone. Good afternoon, evening, morning, wherever you may be, and welcome to this edition of the CARI webinar series. And today, as Joki just said, we have a very special guest, Datuk Dr. Noor Hisham Abdullah. Welcome, Datuk Dr. Noor Hisham. Thank you for making time to speak to us and to answer our questions today. Very often, somebody as well known as Datuk Noor Hisham now, or what the New Straits Times recently described as someone who is a veritable folk hero, and people will say, well, he needs no introduction. However, I'm not letting go of this privilege, of this pleasure and pride in making this introduction and setting it in a context with a opening remarks and statement. First of all, let me say that in the fight against COVID-19, there is no bragging right. A country relatively successful at the public health end of the battle will still face serious suffering at its economic end, especially if it is an open economy like so many ASEAN countries, including Malaysia. Economies that have been frozen by lockdown are not going to be open to those easing out of those containment measures. Countries which are dependent on cross-border exchange of goods and services. So interdependence has no greater significance than when fighting a virus which respects no borders and boundaries. And nevertheless, and indeed because of this, the sharing of experiences which we're getting today, particularly experiences that can assist and encourage, it's most essential in the international and regional relations of a world plundered by a pandemic without precedent in living memory. Now, Malaysia is fortunate to have a government which gives space to professionals to drive the fight and purpose for the measures and propose the measures against the COVID-19 pandemic. We can just look around us and see how countries which do not do so have failed. But you must also be able to rely on true dedicated professionals. And Malaysia has also been fortunate in having a leader of that team of professionals informed and dedicated to that fight to secure our lives and to save our livelihoods. Therefore, as I said just now, I do want to, with great pride, pleasure, and privilege, welcome Malaysia's Director General of Health, Datuk Dr. Noor Hisham Abdullah, the tireless leader of that team of professionals whose sure hand and voice have given the Malaysian nation a sense of comfort in these dark and challenging times. I'm sure he's going to tell us there's still a long way to go yet, But if I may, on behalf of all of us here today, indeed on behalf of the Malaysians among us, I would like to express at the outset our deep gratitude to him and his team for taking us to where we are today, even if, as he would say, there is a long, long way to go. So we look forward to this exchange today to draw upon how much we can learn and work together, both at the national and regional level. Datuk Noor Hisham, welcome again. Datuk Noor Hisham will be making a presentation for about 15 minutes or so, and after which the floor will be open for questions. And I will start the questions with Datuk Noor Hisham. Datuk Noor Hisham, the floor is yours.
All right, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good afternoon to all. And first and foremost, I'd like to thank Tan Sri Munir and the organizing committee for having me this afternoon. And thank you for your kind introduction. And perhaps let me start with the global trend of COVID-19 cumulative confirmed cases. Can we have the slides, please? Now, next slide. As of 3rd of August 2020, we have 188 countries affected by COVID-19, and the cases confirmed to date, almost about 18 million cases been confirmed worldwide, and death 689,370 cases globally. And this is certainly a big challenge for many countries, particularly in Malaysia, the developing countries, to handle COVID-19 in regards to how we plan and then how we address this issue locally. Now, next slide, please. We have four sum up in terms of the current situation in respective countries into four distinctive situations playing across the world. First situation here is that is the countries that were alert, aware, and well prepared to acted fast. And you can see that they managed to avoid large outbreaks, and the leaders of these countries lead the commands and have a strong leadership and manage to make decisive decision and good communication with the public. And hence you can see that the curve, they managed to flatten the curve and control the situation. Next is second situation, and this is where we are Malaysia, probably we are in the second situation, whereby there's major outbreak following cases returning from overseas, as well as outbreak from our public groups, high-risk group, and that has been brought under control with strong leadership, population engagement, and you can see that from March until to date, we managed to flatten the curve. We still have some cases, lower double digit and single digit, but we have not contained the infection fully. But this is ongoing process, and this is where Malaysia is in at the moment. Then we have a third scenario, that is a third situation, where many countries achieve to flatten the curve. And we have seen, in fact, there's maybe a single digit or no documented cases. But because of the ease the restriction and SOP, and now they're struggling to have the spike of cases. And this is a real concern for us. Even though we managed to bring down the cases, the moment we ease the SOP, then there's a strong possibility, inevitably, we will end up with a spike of cases. And our concern is that the second wave is much much dangerous, and also spread much more than the first wave. So this is the concern that we have, and we have seen this in Hong Kong, in Japan, as well recently in Australia, in Melbourne. So we hope that we can prevent and learn the lesson from these countries not to reinvent the wheel. And the last situation, I think from certain countries, the cases continue to increase, and rather than going down, the public health measures failed in these countries. And certainly because number one is leadership. There's a mixed information and contradicting information, and the basic principle of public health are not being complied by the public. And we can see that it failed to bring down the curve, to flatten the curve, but the cases continue to increase. And we are not sure the outcome of these countries in terms of the numbers of infected cases will continue to increase, the death will continue to increase, and until a situation, but everyone in the country has been infected. So this is a real concern. Once we already have sparked the wildfire, it is very difficult for us to contain, because the public health measures will be inefficient when you have a wildfire. So our intention is to curb or to contain the infection as soon as possible. Next, we look into our strategic plan. Next, the distribution of COVID-19 detected in Malaysia until today, we have not won the war yet, but certainly we have won a few battles, and I will divide the strategy in terms of how we classified our cases in terms of looking into the managing our transmission in the country. So we have a few battles, and the first battle, we call it the battle of MCO. MCO 1, 2, 3, and 4. The intention of this battle were to bring down and flatten the curve. That was the intention. So movement control order, everyone advised to stay at home. And this is certainly a very artificial environment. And we need the artificial environment because we already have the outbreaks from the public group, as well as those Malaysian returnees bringing the infection in. So we continue to tighten our border. So border control is very important for us to stop people from coming in and going out. That's number one. Second is the local transmission, to control the local transmission. So we have this 4 MCO, that MCO 1, 2, 3, 4, battle of the MCO. And in a small battle, we also have a small battle, localized battle. We call it enhanced MCO, EMCO, whereby we lock down the area, we test everybody, and whether you're whether you're local, foreigners, legal or illegal, we test everybody. Positive cases, we isolate them, send them to the hospital. Negative cases, but exposed to positive cases, we quarantine them. That was our strategy then in March. Then when we managed to flatten the curve and bring down the peak and towards the recovery phase, but then we need to change our strategy. That means the battle, because life and livelihood here, I mean, every day cost, I mean, this MCO is very costly to the country, because I think perhaps we will be informed about 2.4 billion ringgit a day. So we move on to the next strategy, that is CMCO, conditional MCO, whereby we allow not only essential services but economic sector to resume back, but with the SOP in place. However, for the social sector and education sector and sports sector remain, we have not opened it. So, and we also managed to see that during the CMCO battle, we have a few spikes, the 2 spikes that you can see. This is among the illegal and legal migrants. So we managed to contain the infection among them and bring down the curve further. Then once we realize that the numbers are going down, then the CMCO is about time for us to look into the social, education, even sports. And we move on to the last battle that we have is RMCO, Recovery Movement Control Order. We allow all sectors to resume back function, and but with the caveat, you have to comply to the SOP. And the SOP is very important because we need to manage the risk of every sector. And initially, we see a very positive response. This is where we succeeded to bring down the curve to single digit, as well as we have 3 days, 0 cases being documented. That means we succeeded, but our success breeds complacency, and complacency breeds a failure. So we can see towards the end of the RMCO, there are a spike of cases. Again, we have to reactivate our intervention, public health intervention, to bring it down further. So this is what we are doing, because we found a few clusters but contained, but this is a burning ember. Now, if we fail to control this burning ember, it will start to spark a wildfire, And once the wildfire have taken off, it's very difficult for public health intervention to come in. Can you imagine if you have 1,000 cases? That means we do not have the enough manpower public health intervention if you have 1,000 cases a day. And consequently, if we have consecutive 1,000 cases a day for 1 week, our hospital will be congested and overwhelmed with cases. So that's the challenge that we have. So it's proactive prevention measures need to put in place. Next. So to date, our total individual sample, 983,297 individual. We have done the test more than 1.5 million, but some tests been repeated. So positive rate 0.92%, which means every 100 patients that we test, we only pick up hardly one patient. Case fatality 1.39, much better than the global 3.29. So we are our cases are much better. I mean, less fatality in our country. Recovery rate 96%. Active cases as of today 208 cases, and we contain them in our hospital. We isolate our active cases in the hospital, whether they are symptomatic or asymptomatic. So this is from day one, we have been doing that. So to prevent them from infecting others. And in ICU, we have one patient and none been ventilated today. And we have 1,054 ventilators available. But that means our facilities are still able to cope. Looking to our tests, we are doing about 29.99 tests per 100,000 per 1,000 population, almost equivalent to South Korea. But we embrace the test, but towards our targeted population or targeted risk group, and also targeted locality, rather than test for everyone. And Japan is about 8.49, Thailand 5.38 tests per 1,000 population. Singapore much higher, New Zealand much higher, Canada is much higher, and Australia is much higher than this. So as you can see, the cases today, we managed to bring down the curve from 3,000 active cases to 208. Today, we only have one case being reported, and our active cases now is 196 of today. Next. And these are some of our principle and approach. Certainly, I think in our success is because of the Prime Minister listens to the technocrats and the public civil servants, and that's very important. So science is very important. Science have led rather than politics. So this and our approach, we look into the 6 areas. Number one, border control. Tighten the border control. Number two, enhance our health facilities. So this is the initial part. Make sure that we have enough ventilators, enough beds, enough ICUs to cope for, and we have the decant, because our hospitals already congested even before COVID. So what we have done is that decant some of the services, surgery, orthopedics, to our district hospital, and we identified 7 hospitals for COVID patients only, and 33 hospital, hybrid hospital, and we managed to create a capacity about 10,000 beds for COVID patient. Third is looking into public health measures. This is important. Public health intervention at the early stage, and continue to put in place surveillance and make sure that we can control and contain the infection. Third is that I just explained earlier, the movement control order. That is actually a very new, and this is, you need decisive decision by the Prime Minister. We advise the Prime Minister, and the Prime Minister dare to take that decision in terms of, at that point of time in March, this is not the new norm to, to control the whole country or lock down the whole country. But decision has been made, and we have seen by taking the decision, it's not the movement control order, but it enhanced the public health intervention in a very artificial environment, and slowly controlling, flattening the curve, and then moving on to the conditional MCO and recovery MCO. And more importantly, we have to, looking into evidence-based. Each day brings new lesson and knowledge to us with regards to the COVID-19, because this is a novel virus. We have no experience of this virus. So the more we learn about this virus, the more we have to adapt and change our guidelines, our strategy from, encouraging probably wearing a mask to compulsory wearing a mask, for example. It's all based on science and facts. So this is our important evidence-based approach. Then risk communication. Here we are not only fighting with the virus, but we are also fighting with the viral fake news, for example, in the media. So it's important for us to identify very early in terms of risk communication to the public. The more we inform the public, the less fear there will be and they can handle the situation much better. So better understanding by risk communication, better understanding daily, explaining issues and challenges. So our press conference, we have two for medical and the non-medical. In the non-medical, will be led by our Minister of Defense, looking into the whole government and whole society approach. And I've been given the responsibility to look into the medical perspective and how can we engage with the public, explain the issues and challenges based on facts, medical facts, not based on the fake news, not based on fear or but facts, but not based on rumors, but science. And once we have the public trust, this is important. To get the public trust, you need to engage, you need to explain, you need to create the expectation. And we deliver beyond that expectation. And that's how we win public trust. So that is important for us. Once we have the public trust, we hope that the public will comply to the SOP, to the advice that been given by the Ministry of Health. So this strategic communication works well, and we managed to bring the community approach as well. So apart from getting the public aware of their education, etc., this is also one area that we focus on empowering the public in terms of the knowledge, in terms of action. And we also need to protect the elderly, protect the aborigines, protect the children, and we take measures to do the screening and etc. So this is some of the measures that we have taken, risk communication, and our approach is basically trace and track positive cases. And once we have found the positive cases, we will continue to trace those exposed to the positive cases and quarantine them. Then after trace and track, then we test, which the testing is important. So we need to highlight the diagnostic and testing. So we started in December, whereby we enhanced our lab to be ready to test for the virus transmission in this country, because we are fighting with the invisible army. So it's very important for us to have a reliable test to detect them. So we started with 1,000 tests in January. Now we are capable to do 37,500 tests a day. So, and we also started the training for the labs, public and private lab, in January, and we have 56 labs today. And in the hospital, isolation and treatment, and apart from trace and track tests, we isolate and we treat the patient, and we follow a few, we trial a few medicine, for example, dexamethasone, hydrochloroquine, even Calestra or lopinavir, ketonavir. So all kind of medicine, and we are involved in WHO solidarity trial, looking into the various medicine available for treatment of a COVID patient. Next. So we have seen now, you look into the yellow, Malaysia, so we achieved managed to flatten the curve, and hopefully we will continue to do what we do best, that's to bring down the curve further as compared to our neighbors. And Thailand is doing much better than us, but we need to enhance our public health measures and facilitate the activities at the ground zero. Next. So the question is, are we prepared? So learning from our past experience, for example, SARS in 2003 and other public health emergency, MERS-CoV, H1N1. So we have set up a platform, ASEAN Emergency Operations Center Network, based in Malaysia. And we also have the ASEAN Biodiaspora Virtual Center for Big Data Analytics and Visualization based in Philippines, and the Regional Public Health Laboratory Network based in Thailand, and ASEAN Risk Assessment and Risk Communication are based in Malaysia. So we continue to engage. More important is prompt action, make a decisive decision, and first and fast in the implementation. So, and most important was the special ASEAN and ASEAN +3 summit on COVID-19 health via video conferencing on the 14th of April 2020. Next. And ASEAN was proactive in seeking to coordinate its effort and its dialogue with the partners. So again, we share our experiences, and also we have invited the delegation from China, and we learn from their experience the do's and don'ts. And certainly, I think this is important platform for us to work together as a team in the ASEAN region. So ASEAN attitude towards WHO, we stand guided by World Health Organization, and 10 ASEAN members are members of the World Health Organization. And ASEAN even invited the DG of the WHO, Dr. Tedros, to participate in the ASEAN +3 Summit on the 14th of April 2020. Next. So we are in a shared struggle to protect both life and livelihood. This is how we strike a balance between life and livelihood. So our strategy from MCO was more towards the livelihood, more towards life, controlling the virus. But once we manage to achieve that and flatten the curve, then we are looking into the livelihood. This is a very fine balance, and we need to look into the situation analysis of respective country. Next. And the DG of the WHO did mention that the financing and the health response is therefore on essential investment in main 3 areas of focus. There is number 1, to ensure that the core public health measures are fully funded. And then investment of public health is utmost important. Second, to strengthen the foundation of health system, our hospital services, and etc. Third, to remove the financial barrier. And before the WHO, announced a state of emergency, they take into consideration the 3 factors. Number 1 is the virulence of the disease. Number 2 is the infectivity, and the third is economic sectors. And because once they have looked into this, the best way for the countries to end the restriction and ease their economic effect is to attack the virus by aggressive and comprehensive package to measure the fact that is find, test, isolate, and treat every case and trace every contact. Next. So, and this is some of our engagement with the public using various platforms, Facebook, Twitter, Instagram, even our Telegram, and we have a hotline, 24 hours hotline. And this is important for us to continuously engage with the public. So the success is the whole government and whole society. Thank you.
Wow, thank you very much, Datuk Dr. Noor Hisham. I think for a very detailed presentation with such great clarity, whilst at the same time keeping within just 20 minutes. And I think you had underlined the supreme importance of good communication with the public. At the same time, you have also underlined the very important aspect of not slipping into complacency, that the embers are still burning, and therefore there must be public cooperation, and therefore this communication is important for people to understand. I actually, Dato, have had 5 questions to begin with, but I think 2 of them have been knocked off by your presentation, and I just wish to ask 3 to begin with, 3 questions. I mean, I think you underlined the importance of that relationship between the professionals and the politicians, particularly the Prime Minister's strong leadership in ensuring that the professionals' advice is taken. And yet, can I ask you, Dato, nevertheless, there would have been great tension between control of movement and opening up of the economy. You did mention the balance between lives and livelihoods, but there must have been pressures and tensions, and there were indeed, as I know about them, how the business community wanted things opened up and so on. So how was it resolved since the MCO was imposed on 18th of March? That was when there was the greatest amount of tension between the 2 needs. Dato, please.
Well, certainly very challenging at the initial part because, but nonetheless, we have a very good structure and organization whereby we discuss all issues and challenges during that meeting. And I have to defend based on facts and science. And they have to listen to me based on medical in terms of the transmission and etc. But we have to look into terms of where we are at the point of time. And initially in March, we are in an acceleration phase. When we are in the acceleration phase, whatever we do, then we will actually strike, cases, increase the cases further. So it's very important for us to contain at that point of time. So we need the collaboration. So we have to tell the politician, we tell the other ministry to work together to help Ministry of Health, because we cannot do it alone. One ministry, we need to work with, for example, border control. We need the immigration department to come in. We need to look into the police enforcement in the roadblocks. We need the army to look into the illegal entrance to the country. So we need a full collaboration for other ministries. And we need to justify how to go about. But I think based on science and facts, rather than fear, rather than politics. So we put forward our argument, and we argue everything in the meeting, and then decision will be made. So that decision is based on facts. That decision is not based on other than facts. So I think when the Prime Minister listens, and when the ministers listen, and and trust the civil servant, because our intention and all of us in that room is we only have one intention, that is to break the transmission of the COVID infection in the country. So is to achieve that, we have to put medical first, in terms of our livelihood, life first, before our livelihood. So I beg them in terms to follow us, to give us time, 1-2 weeks, to break the infection, that is to flatten the curve. So we managed to see that, and the collaboration comes in. I think once the collaboration is in place, and then we have to empower the public in terms of to engage with the public to come in.
Was there no counter argument that what's the point of having lives without livelihoods? And this comes to my second question. What happens if we have the next wave? We call it the third wave. Actually, some people are saying it's the second wave. They forget that January was the first wave in our lexicon. So the next wave, shall we say? What happens if there is a next wave? What measures need to be taken if there was that third wave?
Well, I think we all gone through this experience, but now we are more prepared than before. So if you compare us in January and February, today we are more prepared in terms of our health facilities, in terms of public health intervention, in terms of our coordination with other ministries. And at the moment that we identify, for example, an outbreak, we will come in straight away to that locality and block that locality. So we, instead of having a blanket lockdown of the whole country, we'll lock down locality, we'll lock down district, we'll lock down the state if necessary, instead of going big. So now, but we have the knowledge, we have the experience to contain the infection. So we have done that for the whole country. Now, zooming in the areas, the risk groups, so we have divided red zone, yellow zone, and even green zone. So how do we, so it's more coordinated now. And I think other ministries, so they understand it better. Initially, because they did not have experience, now they do. And now the trust is much higher than before. Initially, when I came on board, because everyone is questioning, are we going to listen to this guy? In terms of to advise us to do things, but it's not about me, but the decision was made collectively for the Ministry of Health. So we get all the recent information and share the information. And this is where I think if we have a second wave, we are more prepared than before. But the understanding is we have to contain it first and fast in implementation. If we make a decision tomorrow, we have to actually implement it. We cannot take 1 week, because by 1 week, if we strike a wildfire, it's difficult for us to control. Everybody will watch. Life and livelihood. Now, if we fail to contain the virus, the livelihood will be worse. And this is, and you can see many lives will be lost, and also economy will go down. So now that is the fine balance between us. Well, so they were surprised that once we were in recovery phase, I allowed all sectors to open, no more restriction, and they thought that I will continue to to contain certain sectors. No, but with the SOP in place. So we want everything to resume back to normal, but with the SOP. And if we comply to SOP, then that's how we mitigate as well as we manage the risk. And we have shown that we can manage the risk provided the public comply to the SOP. We need strong social responsibility, social discipline, and social compliance. So if we have that in place, I think we can succeed.
Thank you very much. I mean, so it'll be focused in the next time. It'll be very focused and localized and concentrated. Okay, that's a great answer. Finally, on my part anyway, just this question. You mentioned our ASEAN coordination and efforts, responses to the COVID-19 pandemic, particularly sharing of data and information with one another. Do you see any prospect beyond this kind of cooperation to the establishment of common ASEAN standards to allow a more sort of enable cross-border movements in ASEAN? So some people have been talking about common standards with respect to tests that will be accepted by all jurisdictions in ASEAN. People have been talking about common standards in respect of contact tracing, so that, what is evidence of as the movement of a person who's moving into your territory is accepted as good evidence of where he has been, and you would know from your counterpart those are safe areas. Is it possible to do that? Because you had mentioned the 14-day incubation period before the virus, the symptoms come out. So how do you ensure with common standards freer movement, at the same time contend with the 14-day incubation period? And even with a vaccine, with different strains of the virus, how do you ensure that those vaccinated, assuming the vaccine comes to the fore, is safe? So it's a very difficult situation, difficult problem. How do we make sure we address it at the ASEAN level?
Right, thank you very much. Most of our ASEAN members are members of the World Health Organization. So we stand guided by WHO based on science and facts. And certainly we look into how we can enhance our coordination, cooperation with ASEAN members. And certainly we can discuss all the issues and sharing the experience, looking into the education, looking into research, looking into training. But in terms of looking into the green bubble between the two countries, so there must be analysis of the situation of the respective country, and then come to terms with our mutual understanding and reciprocal SOP between the two countries. So we find that we can use ASEAN as a platform to have the benchmark and standards. So if we can create the benchmark and standards agreeable to all the member states, and for that to take place, our issues mainly is to take the leadership. Who is going to take the leadership? Rather than all the countries have to duplicate the services. Why not we come together and be united to develop the vaccine in one area contributed by other countries? Other countries can actually focus in other areas as well. So this coordination is important for us to work together as a partners. And rather than duplicate services, duplicate vaccine development in all ASEAN countries. So it doesn't make sense. So ASEAN is a platform for us to come together. Next is that do we have the knowledge or even the science to develop the vaccine? If we do not, then we can look into the manufacturing. Maybe we have the capacity for manufacturing. But more importantly is that if we can work together on the ASEAN platform, looking into the pool procurement in terms of, if we pool procure for 10 countries, then our volume will increase. And once the volume increase, you can bring down the cost. And this is a negotiation on behalf of the IP by the ASEAN. This is another way of putting ourselves, looking in terms of coordinating and integrating with the ASEAN members. So there are many things that we can do together and address the issue together with the common interest. But the challenge is not only looking to the standard and benchmarking, but the challenge is actually the implementation at the ground. So how can we implement it rather than we continue to discuss, but implement it, in terms of following the benchmark that we have.
Thank you so much. I would now, if I may, Datuk, ask Juki to bring forth some questions from the floor that she has received. There are tons of them, so we'll try and bring up as many as we can. Juki, please take over.
Yes, thank you, Tan Sri, and thank you, Datuk. I'm conscious that we only have about 15 minutes left, and we actually have a lot of questions. I do not want to attempt to filter out those questions that you may already have addressed. Let us just go through and in a rapid fire style, and we address them one by one. So there's one question from Azrita that says, from your observation, how has technology helped the healthcare sector during the COVID-19 pandemic? And what can be done to encourage the swift adoption of technology in healthcare?
Thank you. I think that technology has helped us to enhance our public health measures, as well as to, in terms of close contact, for example, track and trace those positive cases and etc. So apps, but the technology is evolving very fast. So it also helps us in terms of our modeling and the prediction of the cases. So we already predicted that on the 14th of July, we'll have 0 cases, 0 case. And we did have a 0 case on the 14th of July. Even the Prime Minister initially couldn't believe that we can predict that. So we use modeling, SIR modeling and etc. So that helps us. And also technology will help us in terms of implementation and facilitate what we do. It is only a platform, a tool for us to use to enhance what we have been doing. So technology is good, but it needs to be guided how to use it, when to use it, and etc.
Sure, thank you. And next question comes from Eileen Chari. What are the areas needing improvements in the ASEAN or Malaysian healthcare sections to ensure preparedness for the next pandemic? We're not over yet, we're not out of the woods, but what about the next one?
So what we have learned from this short period of time is that we are reactive in our management. That means you talk about technology, we just created our WhatsApps and MySejahtera. It should have been created before the pandemic, for example. So we have to be prepared, not reactive. You have to be proactive in what we do. So I think we look into technology, we look into our system, we look into everything completely from the lab to the hospital. How can we prepare ourselves better before the pandemic, not during the pandemic? So system already been identified. When you have a pandemic, 1, 2, 3, you know what to do. Rather than then only we think how to do, right? So that's where preparedness comes in.
Okay, proactive. And the next question, I know that Dato, you've touched on quite a bit just now, which is about the travel bubbles, but you also mentioned that it is a question of which country will take the lead. The question is that, what are your thoughts on the efforts by ASEAN member states to establish travel bubbles with other member states? How feasible do you think this ASEAN-wide travel bubble would be?
Right, we are in discussion now with the 2 neighbors that we have, Singapore and Brunei. So we look into their cases and we look into ours. So then when it match, then probably we can actually look into our SOP in detail, the do's and don'ts, and mutual agreement by both sides, and then we can agree upon, for example, in terms of quarantine, in terms of the testing, and how are we going to agree how to manage risks. For example, you have a positive case, what will you do? In terms of working together with using ASEAN platform, we already have the international health regulation. Our first case, the index case, was in Singapore. They informed us, and then we took action of the family members, 8 of them in Johor Bahru. They have crossed to Johor Bahru. And because of the information that we got from Singapore, we managed to localize them and then managed to contain the infection. So this is where the working relationship between the two. Now, our principle is that if we can allow interstate travel in the country between Malacca and Johor, there's no screening, there is no testing. But can we do that with Brunei? Can we do that with Singapore? Provided we share the same platform. So then only we can actually allow. But now discussion is ongoing because the fear, we have to manage the fear, we have to manage the risk, how to mitigate if we have positive cases. Now Singapore, certainly the cases are there among the illegals. I mean, among the foreign workers. So if foreign workers, for example, we do not allow foreign workers to cross, but we allow Singaporean to cross because we look into the data on both sides. So data help us to manage and even to decide. So I think this is one platform we still in discussion whether we can implement or not, and when can we implement, we are not sure, but we look into the current situation in respective countries.
Okay, thank you. Next is about the second or third wave. I know Tan Sri touched on that and you also discussed about it. I think the question is, how likely is it? Because it's one of your deep concerns when you say this is a third situation in your first slide.
Yeah. So we have the first wave on 24th of January until mid of February, first wave, and all related to tourists from Wuhan directly or indirectly. So, and the strain that we look into the virus is a B strain virus. So it is actually from Wuhan. Then we have a period of 11 days, no cases been documented at all. Then case 23 came back from Japan, Tokyo, and 24, 25, all coming from overseas now. Malaysian returnees and also permanent residents coming back, and they are positive. So that was our second wave. And second wave was involving other countries then. We look into the virus, for example, from Indonesia coming into our country. They are actually a strain C virus. So this is totally different from the Wuhan. So our concern then at that point of time is that those Malaysian returnees from other parts of the world, and today from US or UK and etc., so they may bring the infection in. So if we loosen our border, it is inevitable that we get a third wave. And the second is, if our public fail to comply to our SOP, it is inevitable we'll get the third wave. So it's up to us now whether we can. Ministry of Health and Government would not succeed if the public is not with us. So we need a whole government and whole society approach, compliance to the SOP, social discipline, as well as social responsibility, because it's not about you, it's about your community, family and community and the country. So we need to take care of our country, empower the community to do so. And this is where I think it's important. From day one in March, the longhouses in Sarawak, they already started to control their border. No visitors to come into their longhouses. So they have actually put on the measures because we have to protect the vulnerable groups, and they are one of them. And as well as the elderly, old folks home and etc. So we continue to protect them because if they get the infection, they will their immunity as well as their age and immune system, they will succumb to the infection very fast.
Right. Thank you. And that question was from Mr. Jared from PIDM. And next is about collaboration with our neighbors as well as China. You mentioned that in one of your slides, yeah? I think the question is about how regular are these meetings, that is collaboration and information sharing on the pandemic between ASEAN counterparts and China. Are there any key findings arising from these meetings? Is there a common game plan and strategy going forward?
Yeah, thank you for that. So yes, we are in discussion with our members in WHO. We have frequent meetings under WHO, and we can use that platform for discussion as well. We also have country-to-country engagement in discussing issues like vaccine, for example, with China. The three companies that we have is Sinovac, for example, Sinopharm, as well as Sino. So three companies looking into the vaccine development. They are in the clinical trials. Initially, we wanted Malaysia to be the hub of clinical trials, but we do not have many patients now to do the clinical trial. So they are taking the research to Brazil, for example. And we know that, but if they have found out have a strong evidence to suggest that vaccine works, we would like to volunteer to be the hub of manufacturing for ASEAN countries. So that's another negotiation ongoing. But having said that, we need to look into the data first before we can make any conclusive action.
Right, thank you. So some of the questions I have, you've already addressed them. So I will just jump to very quickly to this set of questions. I think it's touched on vaccine, right? You also mentioned quite a bit. This is from EPF, Utley, Nutsme. Does Malaysia have a capacity to manufacture vaccine? How much dosage would a person require if a vaccine is discovered? Would you recommend to close border indefinitely until a vaccine is discovered? So that's the question. Those are the questions.
Yeah, we have more questions than answers at the moment. Looking into the vaccine response, for example, number one is that when we look into one of the studies in UK as well in China, when the delegation came, they informed us after 3 months, only 17% of those infected have antibody. And we did a study our own in one of the cluster who have got infected, and then we test them after 3 months, only 20% have antibodies. So which means those infected only have 20% of antibodies, right? Rather than we are expecting a herd immunity probably about 80% or 90%. So we do not have that in after 8 weeks, you can see the decline of the antibody response. That is IgG. IgM, you start with IgM and then IgG. So then, which means that there are two things here. That means the antibody starts to decline after 8 weeks. So number one, the person may get a reinfection. Number two is that, what about vaccine? Vaccine is a live attenuated virus. Does it work to sustain it? Then how frequent do you give the vaccine? So we have a lot of questions, but we do not have the answer until we see the phase 3 clinical trials. Then only we can make conclusive evidence to support or even to against it. You have a vaccine, maybe it's not effective. Then why give a vaccine in the first place? So we want to look into the data first before we make any comments. Certainly Malaysia can be the hub of manufacturing, there's no doubt of that. But now is the clinical research at the platform that we want to see data before we can actually make decisions.
Yeah, and I know you also mentioned that there are more than 20 types of mutations by now, so it's a bit even harder to predict. I will move on to a set of questions sent in by BFM Media, Jason Lim, news producer. Some of the questions have already been addressed by you, but one of them is, what are your thoughts of undocumented migrants who could spread COVID-19 and other disease across ASEAN borders? What policy should be taken while preserving their human rights? That's one of them. And the next one is, hospitals in Singapore and Thailand have a policy of treatment first, pay later. And in Malaysia, private hospitals require patients to pay a deposit first before receiving treatment. Should Malaysia also adopt what's seen in Singapore and Thailand to make it easier for locals, as well as being competitive in the medical tourism sector? Those are the two questions.
All right, the first question with regards to the human right, when we come in and lock down the certain locality, for example, we treat everybody the same, local, legal or illegal. We swap everybody, we give them the treatment, we give them food, everyone the same. So those positive, we'll isolate them in the hospital. Those negative, exposed to positive patients, we'll quarantine them for 14 days. After 14 days, the local resume back to normal activity in their life. The legal resume back to normal. What do you do with the illegal? Number one, they are not documented. We have no records of them. And then they go to hiding, for example, and they live in a very crowded, confined space. And the infection rate, we noted about 40% positive among them. So we have to, illegal, we leave it to the immigration department. So immigration department will put them in our detention center. And that's where you see CMCO, we have 2 spikes in terms of the infection in the detention center. But nonetheless, it was detained, and then we managed them in our detention center. Positive patient, we put them in our hospital. Negative patient, we quarantine them in the training center in Port Dickson. So we managed to bring down, and then we deport them back to their respective country. And we managed to discuss with the respective country to accept them. So that's the best we can do as far for illegal. I think this is across any country will do that. For the illegal, there's no issue. We are continuing to enhance the legal workers, for example, looking into Act 512, that certain accommodation in terms of their right, their welfare, and also their medical examination. So we will, I think in September, we're going to enhance the Act 512, looking into their cramped environment, cramped accommodation, for example. So there's already a standard for them, but the enforcement of the standard will come in. So this is where we look into illegal.
Sure. Dato', if you okay, can you take 2 more sets of questions?
I have all of them.
Okay, good. This next set of questions come from the Star Media Group. journalist Zakia Koya. The questions are: the first world countries, which ASEAN countries do rely on economically, are still struggling with COVID-19. How do we make sure ASEAN countries are kept safe, but not to the extent of complete devastation of economic ties? I think this relates to the life and livelihood question that I think both you and Tan Sri discussed. At what rate can the government of any ASEAN country open up borders? I think this one you've addressed. Maybe just the first question will do.
We have to look into how we open up slowly and surely. So we start with the local domestic economy. And this is where we should learn from New Zealand, because they strengthened their border, but they enhanced their local economy. So if we can do that, for example, tourism, 60% of the income from tourism industry comes from domestic, 60%. So if we can enhance the tourism, we are not going to make profit, but survival for this year. So if we can do that, I think we can actually start the economy. I think we have started economy in the CMCO until now. So we do not see outbreaks among, if you follow the comply to the SOP. So we continue to monitor the situation and look into how we strengthen the local economy first. And obviously the exports continue, but the tourists now, the border control must be tightened. And we must have a certain, for example, business, etc. They must comply to our SOP. Now we realize that they come in, you spend 14 days. Now we are talking, is it possible for them to pre-quarantine 14 days in their respective country before they fly in? So that's one of the suggestions being put forward to them. So if they can quarantine 14 days, test day 1 and day 13 in their respective country, day 14 they fly in, we can actually look into that. But again, our concern is the in terms of compliance, in terms of we have the SOP, but they do not comply to SOP. If they can comply, that is actually the one way of doing it. Or they come in, then we need to look into the fear is the incubation period. So we realize that 25% of them positive of day 13. So if you quarantine them for 14 days, 25% will be positive. Those exposed to the virus. So the positive cases, 25%. So that's where our concern is.
Okay, thank you. The next question comes from The Edge, from Mohammed. The question is: there is an increasing number of public listed companies announcing plans to divert their production and distribution capabilities into manufacturing medical products and equipment, such as face masks and shields, COVID-19 test kits, hand sanitizers, and disinfectant products, as well as medical ventilators. Some say that these companies are only looking to ride on the hype to merely push up their share prices in the near term. So what is MOH standard on this? How will the ministry be selective in giving its green light to these companies?
Before I answer that question, I just want to clarify the 25%. The cases that is positive, 25 found positive, 25% is from the swab on day 13, not the whole quarantine. That's right. So sometimes, you may be mistaken for the whole quarantine, number of quarantine, then 25% positive is not. The cases that is positive is only about 1 or 2%. But the 1 or 2%, 25% is day 13 positive.
Okay.
Now, with regards to the sanitizing, we have guidelines from WHO. So how to use, what agents to use, even a glove, even a mask, for example. We have a non-medical mask and non-medical fabric mask, 3 layers and all that. So it's spelled out in the WHO. So we realize there's a lot of innovation and technology being released during the crisis, but they have to be registered under the Medical Device Act, that is Act 737. Otherwise, that is illegal for them to actually sell items that are not registered in this country.
I see. Okay. I think if I may just, because you're talking about the percentage, right? There is actually a question on this as well. So it's about the percentage of testing, that we're not testing the whole population, and do we count it as success if it's at 30%?
Yeah, so now what we are doing is targeted testing. So it's just like whether you carpet bombing or you do a targeted testing. So that means we want to test, if it's a state, for example, it's already a green state. Do we need to test everybody? It's a green state, there's no reports at all, So our resources, we better, focus on the targeted group and location. So then our yield will be much higher. Even then, our outcomes is only 1%. So if you were to do in a green zone, it will be less, probably 0.01%. Preoperatively, so we have the surveillance in terms of ID cases, in terms of CARI cases. CARI means respiratory infection, so we test all of them. You come to hospital, we test all of them. Clinic, if you have respiratory symptoms, we also test them. And pre-operative cases, before you go for surgery, we will test you. So we have done about more than 80,000 tests, those going for surgery before operation. And the positive is 0.1%. So it's still, so we are looking into the community testing. So if you were to test everyone, the yield is very low, maybe 0.001. So now targeted group, we are looking at probably 1% only. So maybe like Tafiz school, about 3%. So then it's much higher than we go along that target. So it's more focused. It's just like when we once upon a time use chemotherapy for treatment. It is actually carpet bombing. All the cells die, not only the cancer cells. But we are targeting now. The chemotherapy is more targeted. So we are using that approach targeted from day one. So in terms of cost effectiveness is actually high. And in Selangor, for example, they did a study, test everyone, 5,000 of them. And the outcome is 0.12 or something. Right? So it's so very low in terms of, if it's very high, yes, we do a test more. So that's how I think we look into our testing. And we look into our New Zealand, they're also testing about 4,000, 5,000 tests a day. So we have the capacity of 37,500 now. So we are doing with the RTK antigen, RT-PCR about 10,000 a day.
Okay, thank you. I think I'm stretching it, but one last question, if I may. This question comes from Dr. Raymond Kwong. What is the impact of COVID-19 on indigenous communities, perhaps in Malaysia or in ASEAN? Do we have the statistics on this?
So far in Malaysia, we have not seen a cluster among the orang asli in the country. So what we did is we protect them. Protect them means we disallow people from outside coming into their environment. So it started with the longhouses, for example. They have done that, and we are also looking into the green zone. So we protect the green zone, we protect the Aborigines in their respective environment. So we disallow the public to, not only for COVID, but they also bring other infections, measles, chickenpox, and etc. So they have to be protected. There is one of the targeted group that we need to protect, and we are doing that as well.
Okay, thank you. I just would like to say that, we really have a lot more questions that we haven't been able to address, and I want to thank everyone for your active participation. But also for the benefit of those your questions may have been read out, is because those questions may not fall under the purview of Datuk Noor Hisham and the MOH, maybe it's other ministries. With that, may I hand it over back to Tan Sri.
Thank you, Joki, and thank you very much, Dr. Noor Hisham, for your candor and clarity and very detailed answers about how you approach problems and issues. I think you left us with, from what I see, 3 very clear messages, and what would have been my first question to you, what has put Malaysia position in relative success compared to other countries. I think the first point is critical. You are on top of the situation. You are on top of the situation. The country has got to be on top of the situation, and science has got to be on top of the politics. And this has happened, and this has helped Malaysia, and may it long continue that the Prime Minister ensures that the science triumphs over the politics. The second factor, unrelatedly, is, I think relatedly actually, is because of good communication with the public. The public, when they are informed and they believe what they are informed, communication is good. And if it gets politicized and so on and so forth, the communication won't be good, the public won't believe it, and therefore there will start to be problems. Point number 2, very important to continue. And the third one that you have underlined is no complacency. And Malaysia has succeeded because the public have also been adhering to SOPs, but they cannot be complacent, let it slip. And therefore, if they did, we might have problems again. So I take those 3 main points home as something that Malaysia has to take account of and can be proud about, and we should carry on. And insofar as ASEAN is concerned, something which I'm passionate about, I think I was very encouraged by your message that we can develop common standards on various planes, and we must avoid a duplication. Therefore, someone must take the leadership to develop those common standards and therefore avoid costly duplication. At the same time, we must ensure once common standards are in place, implementation on the ground is sustained. I think we sent you, Datuk, this report, didn't we?
Yeah.
A pathway, and I hope your input later and even today will be useful for some parts of the implementation of this report. And I hope I can get your expertise again another time. And I'd like to thank you for sharing everything with us today. I know how busy you are, how valuable your time is. Believe you me, we are really very grateful that you have spent this time with us. May I, on behalf of everyone, wish you the very best and thank you and hope for your good health and continued leadership in the fight against COVID-19 in Malaysia. Thank you, Datuk Dr. Noor Hisham.
Thank you.
On that note, Yuki, I'll pass the proceedings back to you.
Yes, thank you very much, Tan Sri, and our thanks again to Datuk Dr. Noor Hisham and everyone at the Ministry of Health for their hard work and continue to serve the country and the people. And just a last reminder to all of our friends, we have another CHARI briefings on the August the 18th. Please be sure to join us again. With that, we hope that we will be in touch and we'll see you again in our next webinar. Thank you. Bye-bye.
Thank you, Dato. Thank you, everyone. Thank you. Goodbye. Goodbye.
Pahit ketir hidup dan pengorbanan terpaksa dihadapi demi kejayaan. Terdidik sejak mula tabah berusaha tanpa cuba melangkah tak kemana. Di mana kau berada, pencapaian tak tiba dengan mudah. Kini standing in the eyes of the world hanyalah selangkah dari nyata. Keazaman membara di jiwa menanti saat bebas merdeka. Tiba masa kau melangkah gagah bersemangat ke arah matlamat sedaya upaya. Engkau terunggu wajar standing in the eyes of the world. Harapan yang pernah terkulai layu kembali sekamekar bawah bayanganmu. Setiap manusia ingin berjaya, namun tak semua miliki tuan. Engkau menghampirinya, kesempatan telah pun tiba. Kini standing in the eyes of the world hanyalah selangkah dari nyata. Keazaman membara di standing in the eyes of the world. Standing in the eyes, standing in the eyes, standing in the eyes, standing in the eyes of the world. Standing in the eyes, 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 standing in the eyes of the world. Standing in the eyes, 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 standing in the eyes of the world. Standing in the eyes, standing in the eyes, standing in the eyes of the world.